Welcome patients, families, researchers, health professionals, and decision makers to our CHILD-BRIGHT project update on the Maternal Hyperoxygenation in Congenital Heart Disease, or MATCH study. In 2017, we began the MATCH study to ask whether supplemental oxygen during pregnancy will improve brain development in fetuses with complex congenital heart disease. This is because brain development is impaired during prenatal life, which may be due to abnormal flow patterns and reduced oxygenation to the developing brain. For this reason, our study involves two objectives. First, to quantify the impact of a short 5-minute duration of maternal hyperoxygenation on brain oxygenation in fetuses with different forms of complex congenital heart disease, and second, to investigate the effects of long-term maternal hyperoxygenation on neurodevelopment in fetuses with single ventricles, by providing mothers with supplemental oxygen throughout their third trimester of pregnancy. Our ultimate goal is to improve neurodevelopment during pregnancy so our newborns will have the best possible foundation to build upon as they grow older. Our team has made great progress, where so far we have recruited 49 of 150 mothers for a short-term hyperoxygenation study, and data analysis is underway. For our long-term hyperoxygenation study, we have recruited 15 of 30 mothers to assess the safety and feasibility of our intervention. So far, we found no harmful effects to the baby or mother attributed to the oxygen. However, we did find that our babies were slightly smaller at birth, but without clinical concern. On the bright side, our newborns had less brain injury before their first cardiac operation compared to those who did not receive supplemental oxygen, suggesting that there might be a potential neuroprotective effect from our intervention. Nonetheless, we are working closely with our Data and Safety Monitoring Board for detailed monitoring of the safety of this trial. As part of the CHILD-BRIGHT network, we actively keep in touch with our mothers and families. Through weekly phone calls to our mothers during their intervention, discussions during hospital visits, and our very first virtual meeting with our families and principal investigators last summer, we shared our experiences with each other to address strengths and weaknesses of our study. For example, our mothers and families expressed their gratitude for the active support and flexibility from our healthcare team. On the other hand, participant engagement has led us to improving the intervention, such as by humidifying the supplemental oxygen to resolve dry noses. Our mothers and families have showed great resiliency, courage, and strength, and we can't wait to have more discussions with our patient partners and key stakeholders along our journey to put patients first. Although this is a brief update, we gladly invite you to attend our poster session for more details and discussion. Thank you very much for listening, and we hope to see you soon.